Hello, and welcome to the Workforce Wisdom Podcast. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes will lead to an in-depth, thoughtful discussions with recognized industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Industry Insights, Unlocking Leadership Potential in Healthcare with Executive Coach Allison McCarthy. Welcome, Allison.
Thanks, Christy. Great to be here.
Great to have you. For our guests, Allison is an ICF credentialed coach, a natural extension of her successful career that spans executive roles in major organizations and as an entrepreneur and principal of a successful consulting firm that she co-founded. Allison created and served as principal of Barlow McCarthy for nearly 20 years, leading consulting engagements in areas of strategic growth of hospitals and health systems. Her clients include C-suite executives, vice presidents, and directors. Well, let's just jump right in as we go through some of the topics today. So what inspired you to transition into executive coaching after your extensive leadership experience?
Yeah, if I think about this as it relates to the physician recruitment part of our industry, I noticed in the last several years of consulting that it seemed like physician recruitment was moving farther and farther away from the C-suite. It was being perceived more as a tactical resource than it was a strategic arm. And so my goal in moving into coaching was in particular for physician recruiters and physician recruitment leaders, as well as executives and C-suites, is really to help them understand that physician recruitment is a strategic arm of the organization. But that also means that those who lead those programs need to be able to recognize how to integrate with the C-suite, how to make sure they're communicating the results, how to work collaboratively to set priorities so they can be successful, and what it really takes to do physician recruitment effectively. The resource, I see unrealistic numbers going on of, number of physicians and other allied health professionals they're expected to recruit with the number of recruiters on the team. Again, that was to me another example of we're getting farther and farther away from the folks that are making the financial resource decisions and on their understanding of what it takes to really recruit effectively. So coaching was my way of coming back and saying, how can I help more?
And what are some of those key signs that you look for or that an executive might identify in themselves that, they might need a coach or another resource, even if they're performing well or the organization is performing well? What are some of those key signs that folks come to you looking for support on?
Yeah, so, some biggies are those leadership skills like communication, as I mentioned before. How do you communicate up? How do you communicate across? How do you communicate down? A lot of that takes self-awareness of who you are, what your behavioral tendencies are, and then trying to understand the same in the other person. So your communication is in line with how they hear and receive information and not necessarily the way you prefer to communicate. Setting priorities is another one. So I did a training, for example, for a group of mid-level leaders in a health system on how to think strategically. As physician recruiters, we know how to think tactically very easily, but thinking strategically is a way that we can communicate more effectively with that upper level. Recognizing gaps in team members. I just finished a physician recruitment leadership collaborative, and one of the hottest topics that they wanted to cover was having difficult conversations with team members, how to motivate them, how to get them to perform more effectively, how to be more collaborative with team members, doing the details and all the details that are needed. Another big one is dealing with burnout. And I know that's a question that's coming up, so I won't stay there long, but how do you manage yourself in all of this? And, I guess one other was, I'm thinking of an example of somebody who wanted to become director of the recruitment program. She had been passed over once before, and knowing the opening came again, she came to me and said, I want to make sure I get it this time. So would you coach me to make sure my interviewing is top notch and that I'm coming in having thought through what this program needs before I even start the interview? So those are just a few examples of why somebody may want a coach.
Yeah, those are great. I think you spoke to several pieces in there that it can be from a growth standpoint, or it's really, how do we push forward, like you said, into that strategic realm of what happens in a hospital. Knowing, I know we're getting to the burnout question, but, it's difficult as folks reach out to me about healthcare careers. It's not for the faint of heart. The work we do has immediate impact in every community that we serve. And I think pieces of that engagement are very different than other industries. It is 24/7, 365. And, I think most of us know that emergencies don't happen during the workday. It's always, a late night or an after hours thing. So coaching somebody as they're looking, maybe an early career person, are there pieces that you would share with them if they were early career, maybe finishing an MHA or an MBA program, looking to come in for a job that, make sure they're aware of, like this is different. This is what you will see. As you talked about that recruiter who was looking to move up in their organization, similarly about, new healthcare leaders. Do you have, some tips that you share with those folks?
Sure. And I think a few things. One is that I think they need to understand that this is not just sitting at your computer and doing a bunch of emails or a bunch of phone calls. There is a really broad stakeholder group that we have to work with when we do this effectively. And it doesn't matter what specialty we're talking about or what kind of clinician we're talking about. We have that clinical leadership that not only is going to interview, but also is going to be the place where they practice eventually. They need to interview well. We need the details from them of what it looks like to actually practice in an environment. That means we need to come in skilled, being able to ask really good questions. Not just those very high level, broad, tell me about this position, but be able to go in deep. So I think folks need to come in with a high level of curiosity and wanting to learn, wanting to understand what makes healthcare tick, wanting to just absorb as much as they possibly can, come in with an awareness, as you said, of it's 365, 24/7, but also how to put boundaries around themselves, really being able to recognize, okay, what is that emergency and what isn't that emergency? And if it is an emergency, how do I communicate with whomever I need to communicate about the emergency in a way that they will accept it and respond to it so we don't get ignored, because that happens a lot. So back to those communication skills. I think a lot of new folks come in just wanting to please. I just want to do a good job and I'll do whatever you tell me to do. And I'll just take it all on. The reality is we can't and be successful. So being able to know how to really focus on what you're trying to accomplish, what you can achieve, what's realistic for yourself. And that, I think, is a collaborative conversation that really needs to happen during the interview process. So the recruitment leader even has a good sense of what's that focus look like, what's going to take to be accomplished, and not throw too much at them at the front end as well. So it's a real partnership there to make that happen.
Yeah. Yeah, it really sounds like a lot of self-awareness. And is there any other specific things in terms of your coaching to help cultivate that self-awareness? It's very difficult to turn your perspective inward or look in the mirror. But anything else there in terms of coaching?
The first part about coaching is that I need to be sure I've created a safe space for them. So often the early part of the engagement is me getting to know them, their context, etc., but and them as a person, but also getting to know their environment, who they're working with, what they're seeing as the dynamics, what their perceptions are of what they're seeing and experiencing, and then helping them to understand what are their motivations, what's driving them emotionally, and really building an awareness of that within themselves, what those drives are. I mean, I can say after 30 plus years, I still have to manage my own drives, of what pushes my buttons and what doesn't, and respond accordingly, taking that pause, really thinking about, is this going to work if I respond this way or not? So what we do as a coach is sort of play out scenarios and ask questions about, how did you respond? How would you have preferred to respond? What do you think would have worked better, et cetera? And through those questioning techniques, we help them to build their own self-awareness and think through, how might they change that in the future.
Can you share a success story where an executive coaching transformed a leader's approach and their outcomes?
The one that comes to top of mind is, this was a woman who was a practice administrator, and she grew up in a tough environment. She grew up with a single mom, and she became a single mom herself. And she worked 3 jobs to take care of herself and her daughter. She came in as a receptionist, moved up to practice manager, and then became a practice administrator. But she had a level of toughness about her that she developed because of all of those prior years. That was part of how her personality adapted. I will give her tons of credit because she was so receptive to working on that part of herself, so that her interactions with her staff and the doctors that worked in the practice were softer over time than that harsh way she was managing them. She got to know them on a real interpersonal level. She got to know what makes them tick in a better way, so that, there were times in the beginning when she was correcting them harshly in front of other people. It's sort of one of those things you don't do. But we had to really work on some of those basics. And she changed herself. She changed her behavior. And then everybody around her just changed their reactions to her in so many ways. And so she went from she was on a PIP at one point, to actually being seen as a strong practice administrator within that medical group. And I was just so proud of her that she made that transition. It was beautiful. Now, for me as coach, not easy. Those are hard conversations to have with somebody, right? But for somebody who's open and receptive, it works.
Did you know PracticeLink is not only home of the most widely used online physician job board, but we also have our own magazine? PracticeLink magazine has not only won several awards, including 2 ASBE Awards of Excellence in 2023, but it's also completely free. Over 375,000 physicians and residents receive copies of PracticeLink magazine each year, and you can too by visiting practicelink.com/magazine. That's practicelink.com/magazine. Thank you for listening. Now we'll return to the podcast.
So we've kind of touched on, healthcare is a very high stakes and it's very fast paced. Are there some unique challenges that leaders in healthcare face that coaching can help address?
Yeah, I think the first one is adaptability, right? Being able to live in gray and not have to have black and white all the time. It's a hard area if you're a person that has a natural way of thinking black and white. It's either or. To live in that and space is really hard. And so it's learning how to sort of almost think options rather than it's going to be step 1, step 2, step 3, and an automatic, process. I'm going to try this. If this doesn't work, I'll try this. If that doesn't work, I'll try this. So learning how to be adaptive. I think also being a prompt decision maker is the next hardest thing. We don't have the luxury of time more often than not. And if we talk about recruitment, we rarely have the luxury of a lot of time to make a decision. We know if we want a candidate, a decision has to be made quickly. Again, that takes really good, strong communication skills to help the organization understand you can't dilly-dally. You gotta move quick. But we need to communicate in such a way and present the information in the right way, have them understand the marketplace in order to get them to make those quick decisions. So we need that information at our fingertips so we can influence them accordingly. I think the last one, and probably the biggest one, is emotional intelligence. We talked about self-awareness, which is a piece of emotional intelligence. There's also social awareness. How am I interacting with other people? How are other people receiving me? There's motivation. How do I motivate myself? How do I motivate other people? Empathy, social skills. Those are all the pieces of emotional intelligence. And unfortunately, I think in healthcare, we do a lot of leadership development programs, and I'll say in particular with physician leaders. And most of what we're trying to do is just get them to understand how healthcare works. The payer dynamics, the regulations, operations, finance, all of that. But we don't teach them emotional intelligence and the pieces of leadership skills that come out of that. In the physician recruitment world, we don't talk about that a lot, right? It's more task-oriented than it is that emotional awareness we need to really do this job successfully. And I think that's a real gap. Even in nursing training, if you go through any of the pieces and parts of the healthcare industry, we don't talk about that much at all.
Yeah, and the gap that the gap that I've seen identified really is when you get new residents and fellows coming out of training, and then they're supervising an APP.
Oh, yes.
Sometimes the APP may be of a different generation to them. Equally, that APP has probably, loads of experience behind them. And so I think, we found in organizations I've worked in just misses where you do have a new grad coming in and really trying to help them because they are typically getting paid to supervise that nurse practitioner, that physician assistant, and they don't have any skills of how to lead or develop those relationships.
Right.
Is that something that you've worked on in the past? Kind of the new physician coming in and helping them develop those skills?
Yes, exactly. Not even just the new, but the more seasoned as well. And I've been asked to coach physicians even who've been in practice for many years, how to do that. I can think of one example where there was a discussion in front of residents between a specialist and a hospitalist who was leading the residents on how something wasn't done right with the patient. And so we've just created this whole amount of confusion for the residents on, well, did I manage that patient right or didn't I? Or the other interesting thing when you brought up the APPs, it made me think about we look at them all the same. And I think, first of all, a physician assistant and a nurse practitioner are very different trainings, right?
Yes.
So if physician assistant, really looking at, well, what were they before a physician assistant? Did they go right from undergrad to PA school? Were they an ENT before? Did they do something clinically before? So do they have some experience or no experience going into APP? The nurse practitioner has been a nurse before. And so they've got some level of orientation and education, and they also have perceptions of that nurse-doctor relationship they're coming in with. So really helping physicians understand what their own perceptions are, but also what the perceptions might be of that APP, and being able to work with that takes some good conversation.
Yeah. I think of the friends that I've known that have worked their way up into leadership roles, either from a nurse perspective, usually either they did their nurse practitioner route and then did their doctoral work, or a clinical nurse specialist who is probably the smartest clinician in the hospital at any one time. I always knew who I wanted if I was in the ICU to come and round on me, because they're just very, very bright people.
Oh, yeah.
But as you see that progression from the bedside nurse, and then they pull out and do more of those leadership functions, are there any skills specific within the nursing space? Because we do have recruiters who recruit for nursing as well, that may help them, because it is a big transition. Typically those people on the floor, they become your close friends and family. And then if you're moving up, there has to be kind of some walling off of the activities that happen.
Yes. And one of the biggest things, as I've coached some of these nursing leaders, is learning how to be a coach leader. In that, I mean really helping the nurse that's on the floor think through the answer rather than just giving them the answer. There was one I can think of in every coaching session we had. She had 3 or 4 people come into the room during the coaching session, and she'd answer a question. Rather than teaching them how to be more resourceful and think, who else could I ask? If I just took a second and thought about it, what might be the answer? Because that nurse on the floor has been the doer, it's hard to become then the person that's not doing anymore. They were rewarded for doing. Now they have to, this is for anybody that's moving into a leadership position. You have to now think about yourself as not being rewarded for doing tasks, but now being rewarded for helping others to do the tasks effectively and help others to grow. And it's converting into that tasky person, giving somebody all the answers, to really being a leader and helping somebody to think and grow for themselves is probably the hardest transition I've had to coach people through. Otherwise, they don't become an effective leader. And the higher up you go, of course, the more you have to let go of.
Right. Yeah. That delegation, I think, is always, especially if you're dealing with somebody who's a perfectionist or, you care about that quality of work. So having appropriate oversight on a project or a task once you've delegated it.
And the other skill I think of from a nursing leadership perspective is that they're now dealing with physicians and physician leaders. And nursing has a particular way that they've been trained to do things, and physicians have a particular way of being trained to do things. And so there's learning negotiation skills as the nursing leader, that I'm going to have to give some things up. What's the best solution combined for both sides, rather than this is the way it should be done. This is, what my training says. This is how we've learned it. There will be risk if we don't do it this way. That doesn't build for a good collaboration with their physician counterparts. It just creates a rub. That's not healthy. So learning negotiation skills, I think, is another important one.
And I think in the beginning, you mentioned living in the gray. So much of healthcare is process driven, from workflows or, 10 steps, the timeouts in the OR, like so much is very black and white.
Yes.
That it can be hard to, to move into that gray area. I wanted to go back. You mentioned, helping your leaders as a recruiter, helping them understand the supply and the demand of what's out there so that you're not setting up the team for a failure. Go get X number of this physician. Well, quite literally, we're not even graduating that many. They don't want to come live in our location. Really getting to a nice space where you're presenting some factual information. One of the things that I've had teams do is really use a resource like PracticeLink. Go in and see how many jobs in that specialty are posted across the country. And then maybe go one step further into just your state that you're recruiting to.
Right.
Equally in PracticeLink, you can go in our database and see how many opted-in candidates we have in that specialty. If you have any other barriers, such as a rural location or compensation, call schedule, those types of things, like it further just depletes that opportunity for success. How would you, for the recruiters in the audience, like how would you help them kind of create that message, and maybe it becomes part of their workflow when they're meeting with their physician leaders? Hopefully they're in the room during some strategic planning or some development planning for the recruitment goals. But how would you help them kind of couch that message so it's not perceived as, you've already given up before you've even opened the search? So we're not giving up. We just want people to know, don't plan it to hire and start this year from a financial standpoint. We're going to need some running room to get there.
Yes. So you just explained it perfectly. And I mean, candidly, when I was consulting, I would do just what you said in PracticeLink when we were doing sourcing support. And I know Mitzi does that now with her sourcing projects, because PracticeLink is one of the best resources to help get that information. Added to it, some other resources. How many fellows do we graduate, et cetera, et cetera. I think it's really then making the case for this is a needle in a haystack. And is there any margin of improving some of those other pieces we have control over as an organization? So as you mentioned, comp. Can we do anything with comp to make this more attractive? Help me to understand why this is critical for us to recruit today, or could we have it recruited in a couple of years? If it's a replacement, what were the challenges for that person? Why did they leave? Maybe after 4 months or so, the recruiter even calls that physician and says, can you tell me about your experience in that role? What was it like? What worked, what didn't? So maybe there's more clinical supports that's got to be around them to make it a more attractive position. I think it's all of that. I go back to negotiation. I always think of it as a negotiation situation. I'm not going in there to tell the organization that we can't do this. I'm going in to tell the organization, I'll just, from the data, I'll just say it. I have 40 recs of positions to recruit. This is one of my 40. Here's how I rank them in terms of how easy it will be to fill to how hard it is to fill. The harder it's going to be to fill, the longer it's going to take and the more attention I'm going to need to give to it. So of my 40 recs, what ones do you really, really need me to be working on the majority of my time? It's not to say I won't touch it, but are there other things we could be doing internally to make it more attractive? And I will give it some attention. Maybe my attention is, and I remember doing this, way back when I was first consulting, and a community hospital said to me, we're starting a cardiac surgery program and I need to go get the first cardiac anesthesiologist.
Always hard.
There's nothing there. So I just called cardiac anesthesiologists at the academic centers and said, we're doing this. What will it take? What would you, if you were to take this job, what needs to be in place in order to do this? Besides the surgeon, what support? So by that, I was gathering market intelligence on here's what needs to be in place before we go get one of those. I did it again with another hospital that wanted to recruit a trauma neurosurgeon.
Okay.
What does he need for equipment? What does he need for staff, et cetera, et cetera? So sometimes the best we can do is just go do research and bring back the information while we spend the majority of the time on those things where we can have good success in a reasonable amount of time. It's hard. I won't say it easy, but that's where I'm describing being in the gray, because it's not no, we can't, or yes, we can. It's here's the conditions, here's the marketplace. I'm not saying no, but where do you want this in my priority mix of my time, attention, and resources?
Right. Do you find that most healthcare organizations do exit interviews on physicians like they do
No.
their normal employees?
No.
Yeah, I didn't either. Yeah.
No, nor with APPs. They didn't
Yeah.
do any of that. I don't even know that they do with nursing staff, to be honest with you.
Yeah. I if they do them, sometimes I'm not sure what happens with the information.
Correct.
Because it's usually, if they're exiting voluntarily, like they took another job somewhere or it was, whatever that might be, you have to find what happened behind that. Because as a recruiter going in to recruit back into, the worst thing is you get to, site visit interviews at a dinner or someone tells them, your
Correct.
recruit that you worked very hard to get.
Yes.
They tell them all of the bad things, and
Yes.
you just can't recover from that.
And that's where, the recruiter, again, with that good emotional intelligence, recognizes first that could be a risk.
Mm-hmm.
Well, let me go back. First, the recruiter needs to understand what happened.
Mm-hmm.
Often, the recruiter doesn't even understand what happened. They just go told to replace them without any back information
Mm-hmm.
at all. So they need to understand the situation and need to then try to position it. Let's say they're posting on PracticeLink. Well, they need to position it in a positive way, right? So what do we have left to make this an attractive opportunity, knowing we got to go get the first 1, 2, 3, 4, 5.
Right.
And then we have to prep, and we have to think about who's going to be at those dinners, who's going to have the more positive voice, and we may still have to have the person who's at risk of saying something because it would be just a perceptive gap not to have them there, right? Do we need to meet with them in advance and help them to understand that this is not the time to be sharing our dirty laundry? This is a time
Right.
to be making the conversation positive. And how do we help this person to want to come? And how will we help this person to be successful? The way we get at the table is not just by an invitation. We have to demonstrate our value sitting at the table. That goes back to the market intelligence we were just talking about, right? So we're not going to go to the table and tell the story about Dr. Smith and then the story about Dr. Jones and then the story about Dr. McCarthy. We're going in with very high-level information that the C-suite is used to about how recruitment's performing or not, and talking about the themes of challenges, not this one didn't want it because, and this one didn't want it because. We are aware we need to lift our conversation to a much higher level.
We touched on it a little bit earlier, but, really, how do you guide leaders and recruiters in this space, to manage that burnout and really maintain, resilience in their demanding roles, maybe creating some of those personal, professional boundaries that you mentioned? What are some tips that you could provide there?
One of the things I like to do in my engagements with people is if they haven't had a DISC assessment done is to get one done, because that really helps you to understand yourself. It's not exacting, but at least is directional. How do you tend to behave, both your natural state and then your adaptive state? And the adaptive state is then the one you really look at. How much have you shifted yourself when you are at work versus when you're naturally just in your own interactions at home with other people? So that really, for me, and for, I think, the coachee, it sets a great baseline to understand where the burnout and the resiliency needs to be built from. Do they tend to people please? So a lot of what they're doing is fear-based. If I don't say yes, then I'll get in trouble. If I don't say yes, I'll lose my job. If I don't say yes, that person won't like me, and then they won't all of that, which nobody really talks about, but is seated deep within somebody. Really having the confidence, like we were talking about earlier, is to say what you can do, but not to make promises you can't deliver on. I think, good self-care is basic, whatever that means for you. Go for little walks. You and I were talking before we get on the phone of, having pets. Go hang out with animals because they're very nurturing. Whatever self-care means for you, go sit in the car and just meditate for a second, whatever it is. I also think the professional networks are important, and I mean that both as a recruitment industry, and I think the recruitment industry has come a long way for helping them to network with each other and not feel so alone. But I think they also need big networks, good networks inside the organization. They can't be isolated. You need peers across the spectrum, practice managers, other clinical leaders, et cetera. You need a body of people that you can go to that helps you figure out how to connect with somebody else or how to communicate with somebody else. Finally, it really comes down to, when you're talking about burnout, is what's your real core values? Why are you doing this? Why are you in this seat? Why do you want to be a physician recruiter? What part of that do you really thrive on? At the core of it, for many recruiters, it's, I want to bring, healthcare into my community.
I'm going to jump ahead to a question that I think kind of fits in here, but so much of our work now is being done in a remote setting or, virtually, digitally, this type of way. We talked about email and IMs and all the thousands of ways we communicate. So how has that changed either your dynamic from coaching or maybe potential issues that folks are having, especially if they're leading a remote team? That creates a whole different dynamic than the day-to-day of, seeing people in a workspace.
Yeah, I think, we've, and COVID probably just began this huge, big piece of working virtually, and it's taken us a while to really figure it out. We don't feel, let's just baseline is, we don't feel the same meeting people in person than we do on a screen. We just don't get that full emotive piece that we used to. But we can get close. And part of it is really getting to know the persons that we are interacting with. Coaching now, as an industry, for the most part, is done virtually. It's done on web meeting sessions, more so than it's done interpersonally now. So our industry has changed a lot, but what that has meant is, as coaches, we have to figure out how to get to know that person on the video camera. We also have to get to know them using other tools and resources. How do they communicate on email? How do they speak when they are on the camera? That active listening that we're taught in our training is, am I seeing and hearing and noticing body language? So I'm using all 5 senses to really listen to people on the other side. And that's really key as recruiters, but even more so for recruitment leaders. I think as recruitment leaders, we are really gun shy about, well, I think there's 2 things. One is setting performance expectations and really being very specific about them. I think we're not doing a great job with that, so that we're not setting up our recruiters to really understand what does success look like. The second, and that part of that is because we haven't negotiated up what we realistically can do, so then we can't really filter it down effectively. The second part of it is being able to ask good questions on why expectations are not being met. Where is the gap? And really digging into that. And I'm going to also add that I'm not sure we interview effectively either on the front end. I don't think we really get to know the person. I think we interview for recruitment tactics, but I don't think we really interview to understand how the people work and what makes them tick, and then try to see, is this going to be a match in the recruiter's seat, given what they're going to be facing. And I think that takes more interviews than just with the recruitment leader. I think it takes the whole recruitment team interviewing. I think it takes other peers interviewing, so we really understand that person, and can that person work in this environment?
Right. I think my teams, is over the years as we were growing or adding folks, those team sessions, virtual, just by the landscape of where everybody lived, were really helpful. People pick up on different things than you do. And if you're the one leading it, you're really focused on asking questions, and you may not see some of those other things. But I agree. We definitely go into an interview with the job description and the tasks you need this person to do, versus, do they culturally align with the team? Do they understand that fast-paced dynamic? It's always a good question to ask, what's your rec load? What rec load are you comfortable at? Because it is different. It's okay. It's different. People have different strengths within that. So, those were key questions I always loved when my team would do those interviews, and you get to see your own team. You get to see some different personalities from them. Sometimes it helps you identify future leaders because of the way they engage and understand, what that looks like to be interviewing and bringing someone in.
Right. Yeah. Right. Yeah. And, let's face it, this is a very people-oriented role. Yes, we have some technology that's involved in it, but it's 90% people. And interacting with them in all kinds of ways, and people at all kinds of levels. And those people skills just need to be really strong to be successful in this role, without being too much people-oriented, while also being accomplishment-oriented, because we can't just have conversation after conversation and not get anything done. So it's a good combo.
Yeah. Well, we're going to start to wrap up. I'm going to ask a couple of questions here. What distinguishes coaching from other forms of professional development? You talked about, that being a focus, maybe it's networking in a professional organization, but, you've got mentoring programs and training programs and lots of things you can do these days. But what really distinguishes coaching from those other pieces?
Yeah, so if we take training as an example, training is often classroom, or it's done on a video tutorial. You're getting information in. What I love is when coaching gets augmented with training, so that training is done, and then whether it's with a group or it's one-on-one, we really then work with them about how to apply the training into their work mode, or into improving some skill development that they don't have. Because when we're talking about training, that skill development, that change is not quick. That change is a progression, and we take 2 steps forward and 1 step back, and we have to keep sort of climbing the mountain 1 step at a time, and having somebody to partner with to be able to help through those steps is, I think, really important. Mentoring to me is somebody that's already inside the organization that's helping them. I mean, it could be like somebody that's in a mentoring role as like a recruitment professional that's in a different organization. So you could have mentoring both ways. But they're teaching them either the politics of the internal organization, how to get things done, who the people are, how do you navigate it, what advice they might give them for professional development inside that organization. Or it's a recruitment professional that's helping them to understand what did they do, how did they do it, when they had that situation before, how did they manage it. So it's very situationally based on their experience, their knowledge, exposure, etc.
Yeah. No, I think that's great. Any last comments before we do a wrap up?
No, this was actually, it was just fun. You asked me great questions, and I think we got at some really core nuggets of executive coaching, but also how it fits into the, the world we work in. And so I thank you for the opportunity.
All right. On behalf of PracticeLink and myself, I want to thank Allison for appearing on the Workforce Wisdom podcast. For our listeners, feel free to reach out with any insights and thoughts or questions you might have about what we covered today, or check out the Barlow McCarthy section on the PracticeLink Resource Center page, helping both healthcare providers and recruiters. Those are located on our website at practicelink.com, or feel free to email at plmedia@practicelink.com. My name is Christy Bray. Thank you for listening to Workforce Wisdom.